going to do a quick video on anxiety. Now, anxiety is very, very common in our country. Up to 30%, some studies say over 30% of people experience anxiety at some time during their life. As a general rule, roughly 23.4% of women are affected by it and 14.3% of men are affected by anxiety. So it's a very, very common condition. One of the top 10 reasons people seek out medical care and treatment. The causes of anxiety are many. Some would say it's a disruption or imbalance of hormones in your brain, which has something to do with it. That's part of our treatment regimen in Western medicine, which I'll cover in just a minute. But anxiety has a lot of reasons behind it. Past experiences, emotional response to things, time of the month, weather, job situations, lifestyle things that are beyond our control can all change or cause anxiety. Western medicine treatment is classically psychotherapy, so sitting and talking with someone to help you understand the reality of what's going on versus not. Medication, very common. A lot of our antidepressants are also used as anti-anxiety medications. So some of the SSRIs or selective serotonin reuptake inhibitors like Prozac, Paxil, Lexapro, Zoloft. Wellbutrin is a dopaminergic drug. Effexor we use, that's a norepinephrine reuptake inhibitor. There's a lot of these drugs that change chemicals in your brain. For acute anxiety or panic attacks, we tend to lean on benzodiazepines like Valium or Ativan or Xanax. Those all have terrible long-term side effects and are not a good solution. They may be of benefit short-term, but they're not a long-term solution. The best approach to anxiety is understand your relationship to your environment and realizing and accept the fact you cannot be in control of everything. There's a lot of great resources out there to help you understand how to approach anxiety from a very holistic and natural way. Supplements, one of my favorite is green tea. Green tea has an amino acid in it called L-theanine. L-theanine is God's Valium because it's very calming like Valium, but doesn't have long-term side effects or addictive properties. Taking time to rest, watching your diet. There are studies upon studies showing how your diet can influence psychiatric health, depression, and anxiety. High inflammatory diets, high processed diets, lots of fast food, pops and sugars, continuous pastries, those all increase anxiety. So changing the way you eat can really help that. Exercising, one of the best things you can do for your brain is to exercise and move. Get that heart rate up. If you get that heart rate up on a regular basis every week, you're going to lower your anxiety. Huge. Relationship health, working on your relationships around you and really trying to nurture other people's feelings and being aware of those. That's part of what helps you control your anxiety. These are all lifestyle factors that help. Sleep is obviously important. Very direct correlation between limited or lack of sleep and higher anxiety or stress levels. All these things can help you help yourself. There's a lot of resources out there covering some other more direct topics on anxiety and panic attacks in other videos, but please feel free to contact us if you have any questions. We'd love to hear from you. We'd also love to point you in the right direction to help optimize your daily life.